This course provides step-by-step guidance on transferring patients using gait belts, assisting with walker ambulation, and performing range of motion exercises. It also addresses safety, body mechanics, communication, and infection control to maximize both caregiver and patient well-being. Now let's move on to an introduction to patient mobility and the essential role of the CNA. Mobility is a critical part of patient care, and understanding your role will help you keep patients safe and comfortable. First, mobility is important because it prevents complications such as pressure ulcers, muscle atrophy, and blood clots. It also promotes independence and supports psychological well-being. As a CNA, your role is to provide primary support in assisting with mobility-related activities while always ensuring patient safety. Next, it's important to assess patient needs by understanding their physical ability, cognitive status, and any limitations they may have. Safety should always come first. That means practicing proper body mechanics, performing environmental safety checks, and maintaining clear communication with your patient. Finally, you should be familiar with mobility aids such as gait belts, walkers, canes, and wheelchairs, as these tools are commonly used to support patient mobility. By mastering patient mobility and your role as a CNA, you not only prevent complications, but also promote independence, dignity, and overall well-being for those in your care. Let's go over how to safely transfer a patient using a gait belt. This procedure is essential for preventing injuries and ensuring both patient and caregiver safety. The purpose of a gait belt is to provide a secure grip, allowing you to assist with patient transfers safely and effectively. Before starting, explain the procedure to the patient clearly. Make sure they are wearing non-slip footwear. Position the wheelchair or chair correctly, lock the brakes, and check that the gait belt is secured snugly around the patient's waist. Now, for the transfer steps. Stand with your feet shoulder-width apart for balance. Grasp the gait belt securely with your palms facing upward. Instruct the patient to use the armrests or your shoulders for support. Coordinate the timing and encourage the patient to assist as much as they are able. Remember to use your legs, not your back, as you lift and pivot the patient safely into position. Finally, assist the patient to sit firmly and comfortably in the chair. Always keep in mind, never use the gait belt to pull or lift by the patient's arms or shoulders, and communicate clearly before and during the movement. Here's a quick checklist. Explain the transfer to the patient. Lock the wheelchair brakes. Position the gait belt correctly. Use proper body mechanics. Maintain communication. And complete the transfer safely without causing injury. By practicing these steps and following safety guidelines, you'll be able to perform secure and effective transfers using a gait belt while protecting both yourself and your patient. Let's review how to assist a patient with ambulation using a walker. This skill is essential for promoting mobility, independence, and patient safety. The purpose of walkers is to provide extra support and improve balance for patients who experience weakness or instability. Before beginning, ensure the walker is properly fitted to the patient's height. Instruct the patient on safe walker use, and check the environment for any obstacles or hazards. During ambulation, stand slightly behind and to the side of the patient. Support the patient by holding their gait belt or offering arm support. Encourage the patient to move the walker first, then step forward into it. Walk at the patient's pace, allowing rest breaks as needed, and watch closely for signs of fatigue, dizziness, or an unsteady gait. Never rush the patient. Always monitor for environmental hazards, such as wet floors, clutter, or uneven surfaces. Here's a quick checklist. Verify that the walker is fitted and in good condition. Provide clear instructions, use safe body positioning, monitor the patient's tolerance, and ensure smooth, controlled ambulation. By practicing proper techniques and prioritizing safety, you'll be able to confidently assist patients with walker ambulation while supporting their independence and well-being. Let's go over range of motion exercises, an important skill that helps maintain flexibility, circulation, and overall patient comfort. The main purpose of ROM exercises is to maintain joint flexibility, prevent contractures, and improve blood circulation. There are three main types. Passive range of motion, where the CNA moves the joints fully, while the patient does not assist. Active assisted range of motion, where the patient moves the joints with some assistance from the CNA. And active range of motion, where the patient independently moves their joints through the full range. These exercises include flexion, extension, abduction, adduction, and rotation. To perform ROM, explain the exercise to the patient first. Support the limb gently but firmly. Move each joint slowly and smoothly through its full range, while monitoring the patient's comfort. Always stop immediately if the patient experiences pain. Follow the care plan to determine how often to perform ROM exercises and document both the type of exercises performed and the patient's response. Here's a quick checklist. Explain the exercise to the patient, use proper support and positioning, perform the correct joint movements, observe for pain or discomfort, and document accurately. By practicing ROM exercises carefully and consistently, you'll help patients maintain mobility, prevent complications, and support their long-term health. Now let's talk about common challenges and safety considerations you may face when assisting patients with mobility. Being prepared for these situations will help you respond safely and effectively. Some patients may resist or feel afraid during mobility care. Use techniques that build trust, explain each step clearly, and encourage participation to ease their concerns. Always adapt transfers and ambulation to the patient's specific physical abilities, respecting their limitations to keep them safe. Look out for hazards such as clutter, spills, or poor lighting, and correct them before assisting with mobility. Watch for signs of fatigue, dizziness, or unsteady gait. If these occur, stop immediately and help the patient rest safely. Protect yourself and the patient by using proper body mechanics at all times and perform team lifts if needed. Don't forget infection control. Perform hand hygiene before and after care, and clean equipment properly after each use. By recognizing these challenges and following safety guidelines, you'll provide safer mobility assistance while protecting both the patient and yourself from harm. Communication plays a vital role in mobility care. By keeping patients informed and comfortable, you can reduce anxiety and improve cooperation. Start by explaining each procedure clearly. This helps keep patients informed and reduces their anxiety about what's happening. Encourage participation by motivating patients gently to engage in movement, which builds confidence and independence. Always listen to patient feedback and adjust your techniques based on their comfort levels. Pay close attention to nonverbal cues, such as facial expressions or body movements, which may signal discomfort or pain. Finally, provide reassurance by using a calm tone of voice and gentle touch to promote relaxation and trust. By combining clear communication with reassurance and attentive listening, you'll make mobility care a safer, more positive experience for your patients. Infection control and safe body mechanics are key to protecting both patients and caregivers during mobility assistance. Always perform hand hygiene before and after assisting patients. Wear personal protective equipment whenever it is required for safety. Practice safe body mechanics by keeping your feet shoulder-width apart. Bend at the hips and knees, not at the back. Use your leg muscles to lift or support weight, and avoid twisting motions. Finally, remember to disinfect gait belts, walkers, and other mobility aids on a regular basis. By following infection control guidelines and using proper body mechanics, you'll reduce risks, prevent injuries, and create a safer environment for everyone. Finally, let's review competency validation and documentation, which are essential for ensuring safe and effective mobility care. Competency checklists are used to assess skills such as transfers, ambulation, and range of motion exercises. These detailed evaluations help confirm that you can perform each skill correctly and safely. When documenting, always record the time, type of assistance provided, and the patient's response. Be sure to note any difficulties or changes in the patient's ability. Accurate and timely documentation not only protects patient safety, but also ensures CNA accountability and compliance with professional standards. Remember, competency doesn't stop at validation. Continue practicing your skills, attending training, and participating in refresher courses to stay sharp and confident. By mastering documentation and continually improving your skills, you'll provide safer, higher quality care while strengthening your role as a CNA. Mastering gait belt transfers, walker ambulation, and range of motion exercises enables CNAs to provide safe, effective, and compassionate mobility care. Attention to communication, body mechanics, safety, and patient comfort ensures improved patient outcomes and caregiver well-being.